Okay, what does IDDSI stand for? It's the International Dysphagia Diet Standardization Initiative. The committee is a volunteer group of diverse professionals from nutrition, dietetics, speech pathology, medicine, occupational therapy, nursing, patient safety, engineering, and food scientists from around the world. It's a global standardized framework that provides us with terminology and definitions for texture-modified foods and thickened liquids. It includes descriptors, testing methods, and evidence for both drink thickness and food texture levels. IDDSI guidelines are research-based versus our current National Dysphagia Diet Guidelines that were not based on research. What are the benefits of standardizing? The first and foremost is patient safety. Patients are choking and dying due to a lack of standardization. Improved communication between caregivers, patients, and families. With standards, when a patient discharges from the hospital to long-term care, they'll be using the same terminology to describe the diet, so there's consistency, and it's also using terms that are easy for family and non-medical people to interpret. It provides us with an opportunity to research, to collect and evaluate treatment outcomes, and in the commercial world, they'll provide product consistency as everyone's using the same guidelines for their products. What are our objective measures? It says how thick is thick, tells us how soft is soft, and how small is small. For testing of fluids, we have the flow test. For foods, we have the spoon tilt and fork pressure test. It is possible to perform these tests at any time, but testing isn't needed every time you prepare the product. Testing is used for initial staff training, auditing your staff. Kitchen's going to use it to develop and test recipes as we've shown you today, and industry is going to use it to test and develop their products. Testing should be at temperature product will be served. Product needs to hold shape and test at the initial time, 15 minutes later, and 30 minutes later. So we're wanting it to be consistent across time. The IDDSI website has a lot of useful information as well as audit forms that can be used when testing. How does the IDDS terminology compare to our current? There's actually 7 levels. And we'll have a chart that shows the current. We have liquidized, which is level 3 that compares to level 3 on the liquid table. Dysphagia puree, NDD1 lines up with pureed, which is number 4. The current dysphagia mechanically altered, NDD2 is equivalent to minced and moist, which is a level 5. Dysphagia advanced, NDD3 is compared to soft and bite-sized. And regular is broken into 2 levels, the regular texture and then easy to chew, and they're both under 7. In the liquid terminology, we have extremely thick, which is similar to pureed and our current pudding thick. Moderately thick, similar to honey thick, also the liquidized diet. Mildly thick, similar to our current nectar, and slightly thick. Thin has no restrictions. We have a couple of helpful charts that explain and show you the cross map.